Hi, this is John. It's Saturday, about 10 o'clock in the morning. This is 11 days post-op. I haven't done video in this whole last week. The beginning of the week, I think it was around Monday, I started with, everything was going fine until then, and I started with some really severe pain, starting on my low back, going down my right and left leg, kind of like pretty much sciatic pain, starting out in the center below where the incisions were, below the surgery site, and going down both legs, down the side and the back to my knees, didn't go below my knees, and it was excruciatingly painful. And that went on for 2.5 days. I couldn't sleep, couldn't stand, couldn't walk. I mean, every position. Laying down was actually the most painful, so it doesn't do much for trying to get any sleep. I was already on oxycodone 20 milligrams every 4 hours, I think I was taking at that point, so it's not like I'm going to take any more of that. And was taking Tylenol. Couldn't take any anti-inflammatories because of the fusion issue. So I called talked to the PA, and at first he was kind of dismissive, which really drives me nuts. And I'm like, look, this is not just a little bit of pain, it's excruciating. So I don't even know what he said that day, but I wound up calling him the day after. Again, we go over it. He says, okay, fine. And that was at 5 o'clock, I think either the same evening or the following evening. And he said, look, if it's too late today, I don't know what too late today at 5 o'clock means. But he said, if it's still bothering you tomorrow morning, call me in the office and I'll call something in for you. And what he was going to call in was prednisone, steroid, anti-inflammatory. And I said, okay, whatever. So I called in the morning, first thing in the office. He calls me back. He calls it in. My wife goes and picks up the prescription, take it. I mean, it was just, this was the most pain and the most discomfort of this whole thing, far worse than the time I spent in the hospital, except for the transition off of the IV meds. That couple of hours was actually similar to this 2.5 days of real pain, just driving me crazy. So I started the prednisone, and with the second dose, which means within about, I don't know, a few hours, 3 or 4 hours after starting this stuff, the pain just faded away. Got rid of it. It was unbelievable, like the weight of the world coming off of me. So the rest of that prednisone kind of thing is, I don't know, with a 6 or 7 day taper down. You start out with a very high dose, and it just tapers off. Over the next day or so, meaning like Wednesday, Thursday-ish, nerve spasm, muscle spasm, nerve kind of sciatic pain tried to come back a couple times. Rush, get into bed, put a heating pad on it, which is what helps me is heat, and it didn't really come back. So it was tremendous relief to get rid of that. So I've been fine since. I've been tapering down on the oxycodone. I was taking the highest dose I was taking when I left the hospital was 20 milligrams every 3 hours. Stretched that out to 4 hours. And then just tapered that down. And I took the last dose of that this morning. This is Saturday morning, 11 days post-op. And so I feel good. A little bit, funny little pains, coming and going each day. In my procedure, he used my own bone taken from my hip. He didn't use some of the synthetic stuff or cadaver bone or whatever to make up the fusion. So I had this the minimally invasive procedure, so I've only got 2 1-inch incisions on either side of the L5-S1 location, my low back. And I guess he used the same incision to get this bone out of my hip someplace. And he said he purposely wouldn't tell me because he wanted me to tell him when I went back for a follow-up appointment where he took it from, because I guess he prides himself on having a pretty low pain method or location or whatever of harvesting this bone. And sure enough, I mean, up until the last couple of days, I really wasn't exact. I was pretty sure it was the right-hand side. Now that I'm off of the taper down on the narcotics and everything, I'm sure that it was the right-hand side, and it was fairly close to the incision. You just kind of, instead of going towards the spinal column, it takes it right, it goes towards the hip somewhere. I don't know. So that hurts a little bit, but it's really nothing. Yesterday I had a funny pain in the right hand side groin kind of muscle thing walking around. It hurt a little bit. It just came out of the blue. Today it's kind of faded away. So I'm pretty much off of everything, just taking some Flexeril a couple times a day, and I took Tylenol this morning It's now 10:30. It's 4 hours after I took the Tylenol, so it's kind of worn off. I don't know. I have a little, it's just a little bit of discomfort. It doesn't go into the category of pain when you're talking this kind of thing. So I can walk as much as I want. I haven't really walked outside the brace. These things are neoprene rubber in here, which is really is not set up. I mean, if you were designing something like this, you wouldn't want neoprene as a huge insulator. If anybody who's ever been in a wetsuit, think about having this thing of neoprene, quarter-inch neoprene around you. It's very hot and very uncomfortable. So I've only gone outside a couple times. I'm trying to do a fair amount of walking because walking's good for you. It feels good. So I'm doing laps around the house. It's stupid, but it beats going out in the 90-degree Florida humid summer. So I just walk around the house. I don't know, it's kind of stupid and boring, but it's a lot more comfortable with the air conditioning. Other than that, I feel pretty good. Sleeping fine, no problems at all. No problems coming off the oxycodone. I mean, I took the last dose this morning. I don't know. I feel a little bit fidgety or jittery today. I don't know if that's that or just something else, but. So the only thing, again, was this bout of sciatic pain kind of thing was just awful. I mean, I'm telling you, that was the worst. I didn't really think I'd be doing that because last weekend, once I got over the little hump from the ride home, then I was on Sunday and coming into Monday, I was feeling good again. We had friends over for dinner on Sunday night, no big deal. But that 2.5 days of sciatic kind of pain, I hope it doesn't come back. I hope it's not something, because I did have similar kind of pain in the past, not exactly like this and not that severe, but I haven't had any sign of it since. So other than that, nothing really, I mean, it's kind of a no-brainer at this point. It's just time, putting up with. The one thing I did think of is that something that might have actually brought that on, I think I was doing too much sitting, like I'm sitting now in front of the computer. And I do remember, it said don't sit a lot, stand, walk, or lay down. So I have a feeling that I was actually doing too much sitting, and that may have aggravated things to cause some of that pain. So don't do a lot of sitting. That's about it. So feeling pretty good, and I'm looking forward to my follow-up appointment. Today is Saturday. My follow-up is Wednesday. So there'll be a 2.5-hour ride back to that office Tuesday night. We're going to go stay in a hotel nearby, and then go for the follow-up on Wednesday, and then if there's nothing of any significance to do a video on, I won't do anything until I come back from that Wednesday and after that appointment. The only other thing I can recommend is if you can do it, and if you can afford it as a luxury, buy an iPad. It's an awesome thing to lug around with you. I have a walker. They sent me home with a walker, so I use this. I still use it. I don't need it at all to walk, but it's nice to, if you want to just get the load off of your back. Just to, even if you're sitting in a bar stool or something, you just sit on it and put your elbows on it, and you kind of just get the load of some of the weight off your back a little. It feels, feels good that way, and it's also an easy way to carry things around, like a cell phone or whatever you have in it, something like that. But an iPad is a real cool thing to have because it's got all kinds of, it's lightweight. You can hold it in bed. It's convenient. That's about it. Thanks.